There are many causes of watering eyes. Some patients have dry eye, which means they have reflex watering, but I'm going to concentrate on the cause of watering eyes for which we have a surgical solution, and that is a blocked tear duct. The tears drain from the eye down into the back of the nose. And sometimes, with all the pollution and inflammation inside the nose, that tear duct gets narrower and gets blocked. And so patients get watering eyes, particularly when they go outside in the wind. So if a patient is referred to me, like you have been for your watering eyes, first of all I ask you lots about the symptoms. What time of day is it? Whether it's worse indoors or outdoors, summer or winter. Whether other people remark on it, whether it blurs the vision. Then I have to examine you. I'm going to have a look at the height of the tears, see whether they're up or down. Look at the tear sac, see whether that's inflamed. Look and see whether the tears seem to be draining at the right rate or whether they're delayed. And then we have to do some small procedures which are really diagnostic. They are syringing, and that's done under a little light drop of local anesthetic onto the eye. I very gently put a cannula into the tear duct and syringe through some saline to feel the pressure that I'm using to syringe down and see whether you taste the saline at the back of your throat or whether a lot of it comes gushing back over the eye. That gives me a very good idea of whether you're getting a blocked tear duct. If it's completely blocked, of course, all of that saline is going to come back over the eye. I also have to look in the nose. This is because the nose is where the tears drain to, and sometimes people have a pathology within the nose which I have to identify and treat if necessary. And also, if I'm planning to do surgery, I may want to do the tear duct surgery through the nose. That's the endoscopic endonasal DCR, and I have to establish whether there's enough space in there to put the very fine instruments and lights. There's two types of DCR, in fact three. The first one is external DCR, which is through a skin incision. The second one is the endoscopic endonasal DCR, and the third one is one that I call light DCR. That's done through a very tiny incision in the tear trough, just there, which hides within one of the smile lines, under local anaesthetic. It's done here at Clinica London. We use the endoscope in the nose to monitor things and to help with the surgery. And it's making a little opening between the sac and the inside of the nose above where the blockage is.